All right, let's dive right into this explainer. We're looking at a phenomenon that almost everyone has experienced at least once, but honestly, very few actually understand. We're talking about why the sudden glare of a digital screen in a dark room, or, that piercing morning sun hitting your face, can sometimes feel like literal physical torture. Welcome to today's explainer. We are demystifying photophobia and mapping out exactly what is happening when light physically hurts.
We've absolutely all been there, right? You walk into a room, flip on that harsh fluorescent office light, and you immediately wince. Maybe you even throw a hand up over your eyes. It's a completely involuntary reaction. But why does light, a totally massless, intangible thing, translate into a sharp physical pain right behind your eyes? We need to understand what our body is actually trying to tell us when that happens. Because, spoiler alert, your body isn't just complaining about the terrible office aesthetics, it's triggering a real alarm.
So, moving right along to Section 1, eye strain versus true photophobia.
Now, the terminology itself is actually a massive medical misnomer. According to the Cleveland Clinic, if we break down the Latin roots, photo means light and phobia means fear. But if you suffer from this, you know you aren't psychologically terrified of lamps. You're not hiding in a closet from a flashlight. It isn't a fear at all, but rather a severe physical intolerance and sensitivity. Basically, your nervous system is translating illumination directly into discomfort. And getting this difference down is step one for us.
To truly grasp this, we need to compare data from two absolute medical heavyweights, the Mayo Clinic and the Cleveland Clinic. We really have to act like medical detectives here, separating temporary correlations, like how your eyes feel after staring at a spreadsheet for 9 straight hours, from deep-seated causations, because that causation is what clinical photophobia actually represents.
When you check the Mayo Clinic's criteria for general eye strain, you'll see a pretty classic lineup. We're talking sore eyes, blurred vision, a dull headache, and yes, mild light sensitivity. But context is absolutely key here. This type of light sensitivity is usually just a temporary result of overworking the tiny ciliary muscles in your eyes on digital devices. It's literally just muscular fatigue. You rest your eyes, get a good night's sleep, and boom, the mild sensitivity vanishes. It's localized, it's temporary, and it's completely different from the clinical condition we're tracking down today.
Which perfectly sets up Section 2, defining the root causes.
This is where the plot really thickens. When people experience eye discomfort and a sudden aversion to light, the first reflex is almost always to grab some over-the-counter eye drops. We just assume the pain is surface-level dryness from, say, not blinking enough at our screens. But what happens when you use those drops? Your eyes are perfectly lubricated and the light still hurts just as much. Well, if the surface of the eye is totally fine, the problem has to be hiding somewhere else.
And the American Academy of Ophthalmology specifically points us toward a really fascinating diagnostic approach called the rule of exclusion. To find the true source of severe light sensitivity, ophthalmologists basically have to play a game of elimination. By entirely excluding dry eye and standard digital fatigue from the equation, we're forced to look beyond the surface of the cornea. We literally have to follow the anatomical trail inward.
So, we journey deeper into Section 3, beyond typical dry eye.
Once we move past standard eye fatigue, the American Academy of Ophthalmology reveals a completely different class of culprits. True photophobia stems from either specific ocular traumas or severe neurological issues. On the ocular side, you have things like corneal abrasions, which is literally a microscopic scratch on the windshield of your eye, or uveitis, a severe inflammation of the eye's middle layer. But then look at the neurological side, migraines and meningitis. A surprising and absolutely crucial fact to remember here is that a sudden, severe intolerance to light can actually be one of the very first early warning signs of meningitis, which is a highly dangerous inflammation of the brain and spinal cord membranes.
And here is exactly why that pain happens. The light itself isn't cutting your eye, right? Rather, the light enters the eye and stimulates the optic nerve. But because that nerve or the brain pathways it connects to are already inflamed or hypersensitized, whether that's from a migraine or a serious infection, that totally normal light signal gets misinterpreted as a massive pain signal. Light sensitivity is actually a messenger traveling up your optical nerve, sounding a much deeper systemic or neurological alarm. It's a really fascinating, albeit painful, misfiring of your body's internal wiring.
Okay, let's shift our focus to the prescription phase in Section 4. Solutions and daily management.
If you take away absolutely anything from this explainer, let it be this 3-step clinical approach. Step 1 is non-negotiable. You must treat the underlying cause.
Because we firmly established that photophobia is an alarm bell, you can't just muffle the bell, you know? You have to put out the fire causing it. Step 2 involves environmental tweaks, which we'll look at in just a second. And step 3 is to consult an ophthalmologist. Seriously, do not try to play doctor with your own vision. If you have chronic light sensitivity that just doesn't resolve with rest, get a professional to look at your optic nerve.
Now, while you're working with a doctor to treat the root cause, making physical adjustments to your environment can provide some fantastic, immediate daily relief. And this isn't just about turning down your phone brightness, though sure, that helps. We are talking about precision tint glasses, specifically FL41 tinted lenses. These are usually a rose or amber color, and they are scientifically designed to filter out the specific blue and green wavelengths of light that are most notorious for triggering hyperactive optic nerves and migraines. Combining these with warm-tone screen filters can make a massive difference in your daily comfort.
This brings us to the core philosophy of all the medical data we've reviewed today. Photophobia is a symptom, not a disease. Think of your eyes as essentially the check engine light for your brain and your central nervous system. Always remember that listening to your eyes is essential because they are very often trying to warn you about what is happening elsewhere in your body. Treating just the eyes when the brain is the actual issue, well, it's kind of like putting a Band-Aid on a thermometer because you have a fever. It just doesn't fix the problem.
I'll leave you with this final thought to ponder the very next time you wince at your device or feel that sharp pain from the morning sun. In our incredibly screen-dominated world, it is so easy to brush off visual discomfort as just the cost of doing business. But are you just treating the surface symptom with another drop of artificial tears, or are you actually ignoring a deeper source? I strongly urge you to look deeper into what your vision is trying to tell you, because clarity isn't just about seeing the screen well, it's about seeing what your body actually needs. Thanks for joining me on this explainer, and stay curious.